Hi guys, Dr. Zabit here and Dr. James here from the Hunter Valley practice. So today we're talking about whiplash injury and neck pain. So whiplash injury is actually something that a lot of people know about, but for those who don't, it's actually most likely occurring from a rear-end car accident. It's a quick acceleration followed by a very sharp deceleration. So your head go into hyperflexion, so your head goes forward and back in a very short time. And when that happens, we often see soft tissue injuries. We can see people suffering from neck pain, headaches, dizziness, and sometimes fractures as well. So, some fun fact is it is actually one of the most common treated conditioned in emergency room in the US after a motor vehicle accident. And these people usually suffer from about some short-term neck pain, about up to 10 days. And up to half of them, they suffer from chronic neck pain. So they have neck pain after the accident for a longer term instead of just 10 days. So it actually can happen more easier than you might think. So 3.5 G-force is considered as the threshold that causes neck pain. And one really interesting stat from Germany that they would say that 90% of the rear end accident sorry, what was that? So the
rear end accidents are 25 k's or less.
That's it. Thank you, Dr. James.
Sorry.
Do you want to continue?
Yeah, sure. Yeah. So when we think about whiplash, the most common symptoms you'll see are neck pain that will be worse with movement. We can see a lot of headaches, decreased range of motion. Pinpoint tenderness across the base of the skull and our suboccipital muscles are really, really common. In the more severe cases, we can see some neurological type symptoms. So we can see pain coming down the arms. We can also see weakness, a loss of grip strength is another really common one. So we associate whiplash a lot with car accidents. Absolutely, it's a really high risk or high significant factor there. But what about sports? There's a lot of high impact sports that are played. So football and indoor soccer are two of the really big ones that are associated with whiplash injuries, and they often come along with that grade of concussion as well. So when we think about the car accidents, again, the major car accidents, the patients are usually assessed really well and they have their spine cleared and it's usually really well managed. When we start thinking about the more minor incidents, the minor car accidents, often they are missed or even just leave it, it should get better. Now, this is where chiropractors like us come into play because we're known to be really well managing those long-term musculoskeletal complaints. Really good at helping manage and reduce those symptoms. So if you have been in an accident or you know somebody else who has been and they've got some neck issues, or if there's neck issues coming from sport, give us a call and see how we can help you out and see how we might be able to help with your case. Alright guys, have a great week. See you guys next time.